I had a stroke February 10th, 2017, while I was driving down 405. And when I was driving, I all of a sudden realized I couldn't feel my hand. It was hard to control the car. I thought that I had hit a rut and that I got a flat tire. And in reality, my left side was gone and I was hitting the guardrail. And the police came and they said, do you realize you're having a stroke? And I said, I guess I do now. And he said, well, we're going to go to Harborview. And I looked up above him because Evergreen was right behind us. And what about Evergreen? And he said, nope, we're going to Harborview. You need treatment now. It terrified me, but I would just absolutely have loved to go to Evergreen and felt way more comfortable being there than Harborview, just because it's home.
I think it's nothing less than a miracle that she is not only with us today, but she's as healthy as she is.
I don't know that I would be sitting here today, or I certainly wouldn't have golfed this morning. I wouldn't be in that category, let me put it that way. And I did golf this morning and I'm doing well.
So it's just a normal day for me. I came into work and I was feeling fine. And then I went home on my lunch break and was making a grilled cheese sandwich and I started feeling dizzy. So I sat down and just kind of let the dizziness spell pass by. My husband came home and he found me on the couch sleeping, but then as I was waking up, I had trouble putting my shoes on and my jacket and everything. And he asked me if everything was okay because he thought I didn't look normal, but I still thought at that time that I felt normal. At Evergreen, they did a CAT scan, which is where they found the severe blood clot that was in the left side of my brain. And they didn't have the equipment at Evergreen to perform the surgery to remove the blood clot from my brain. So then they put me back into the ambulance and transported me to Virginia Mason. I'm actually one of the lucky ones. I survived. I have no residual effects from the stroke, but had it been any longer than that 20 to 30 minutes, then I don't know what kind of state I would be in.
From the moment Tressa arrived, I was worried about a stroke. She is quite young, but strokes can happen at any age. We considered giving TPA, which is an acute blood thinning medication, but she was not a candidate for that. The next step was to look at her blood vessels to see if she had a blockage in a large vessel. Indeed, she did. And so we decided to transfer her to another facility to do an intervention and try and take that clot out of one of her large blood vessels.
A biplane is like what they use in cardiology to do heart catheterizations, but with two planes it allows you to develop a three-dimensional view. And the blood vessels in the brain are very complicated, and so that 3 dimensions allows you to work in that space. So both of the patients that we've heard speak are very lucky. Stroke is one of those situations where seconds count. And so transport time out of our area, getting diverted between different hospitals and emergency departments can make a real difference in a patient's outcome. We've had a stroke program here for many years and it's been recognized as one of the best in the country. The biplane allows us to treat stroke in the most modern way, which results in huge differences. Those differences are not subtle. These are differences that may be the change between speaking and not being able to speak, being able to walk, not be able to walk, to live dependently or independently, being discharged back to home in the community or being discharged to a nursing facility.
By Evergreen not having the biplane machine, I think you run the risk of people getting the proper care that they need to recover 100% or as much as they possibly can.
Had the equipment of the biplane been at Evergreen, it would have shaved off so much time.
The faster we can interact and the faster we can do something, the more brain we can save.
We have the staff, nurses, neurologists who are experts in the field. We don't have the biplane to be able to intervene yet. It's that difference that we need your help in making.